Hi, my name is Anai and I'll be teaching you the proper way to move a patient up from their bed. I want to apologize for the poor quality and under the circumstances I'm at right now. I don't have the proper equipment to show you, but I'll be trying my best at my best ability to explain it as well. So before moving a patient up from the bed, you want to make sure you always practice hand hygiene first. Not just for positioning a patient, but you want to make sure you do it for before any type of care to a patient. And I showed you guys in another video on how to perform hand hygiene with an alcohol-based rub. After you have completed your hand hygiene, you want to make sure your patient has privacy. You want to, if you're in a hospital, sometimes there's curtains, you want to close the curtains, you want to close the door, you want to make sure that your patient feels very comfortable. And let's get started. So you want to first introduce yourself to your patient. In this situation, I have a real patient, but I'll be performing it on this example right here. So you want to introduce yourself and identify the patient. So for example, I'll be like, hi, my name's Anai. I'll be assisting you and helping you move up in your bed with my partner, because keep in mind you will be needing a partner with you. And I want to identify them with their birthday and name. So you'll ask the patient what's their name and their birthday. You always want to make sure to check their bracelet as well. And before assisting the patient, you want to gather a couple of information. You want to know the patient's weight, how many co-workers or assistants you'll be needing to help you out. You also want to know if the patient could assist themselves or not. So let's get started. So my patient here, I'll be helping them move up from in the bed. Keep in mind your co-worker or the other nurse assistant will be on the other side of the bed. Basically the same thing you'll be doing, your co-worker will be doing the same thing, but on the other side of the bed. So you want to move the blanket. You want to make sure your patient's comfortable. Hi, how are you feeling? Are you okay? Do you feel comfortable? And you want to make sure that you're explaining everything. So first things first, you want to make sure your patient is on a flat surface, like on flat. So if the bed is kind of up, you want to make sure to move the bed down. You want to help your patient remove the pillow and move it as far away as possible. You want to make sure that the patient is laying flat. Once your patient is laying flat, you want to get your draw sheet. In this case, I'll be using the towel as my example for a draw sheet. So you want to, obviously in a real situation, you'll have like the more, proper equipment and you'll be in a more comfortable position. So you want to put it right next to your patient. In order to get the draw sheet in the middle of the patient, you want to move your patient side by side. So you want to carefully help your patient move to the side like this. You want to make sure he's on the side. And you want to carefully move the draw sheet into under him. Then you'll help him roll back and make sure to always let him know what you will be doing. And don't forget to always ask, are you feeling okay? Are you feeling comfortable? You always want to make sure your patient is comfortable. You don't want him to be in any type of pain. So you want to kind of fan roll the draw sheet. Keep in mind, your co-worker or the other nurses on the other side will be doing the exact same thing as you. So your co-worker will help the patient move to the other side and get the draw sheet right under the patient. And then you'll help them roll back and be flat. And then once you have done that, you and your partner and coworker will grab each side of the draw sheet and fan fold it. And the same thing will be done on the other side, like I said. So once you have done that, once again, you want to ask your patient, are you feeling okay? And let them know what you're about to do. So now this is where you're going to help your patient move up. So you will be holding on the draw sheet, and your assistant will be doing the same thing on the other side. You want to put your left foot forward, and you want to put your leg backwards but straight. And you want to bend at the knees and the hips, so you want to have a wide base, for security and safety reasons. Once you have done that, you want to grab on the draw sheet, and as your partner will be doing the same thing on the other side, you want to tell the patient that in a count of 3, will they move their head up. And then when a count of 3, you and your partner, you have to make sure you and your partner are on the same page. So you guys at 1, 2, and 3, pull the patient upwards, and then the patient will move its head. Then you can grab your pillow, or you can ask the patient if they want the pillow, and place it behind them. Once you move your patient up in bed, you want to ask them, are you okay? Are you comfortable? Are you in pain? You always want to make sure your patient is comfortable, and you want to assist them with a blanket. You want to ask them if this is comfortable for them. Once you made your patient feel comfortable, and you're all done. Thank you.